I'm presenting this paper. I'm from the Colla MacDonald from the University of Ottawa, which is the capital of Canada. And I'm presenting with these colleagues who couldn't make it today from the University of Western and faculties of medicine within the University of Ottawa. And I'm just going to show you some of the research that we've been doing on online learning and face-to-face learning over the last 15 years. This is called the We Learn Framework. It's published in at least 2 different presentations. One is on the theory behind the model, and the other is on the components of the We Learn Framework. We is for collaboration, and of course, eLearn is for online learning. If you Google We Learn, you can come up with the 2 publications and learn more about it. The reason we designed this framework was because I was working with Health Canada and evaluating their proposals that were given on interprofessional education, and one section of the proposal was asking for the people applying to evaluate their research. And when I did a review of all the ways they were evaluating their interprofessional education, I found that they didn't have a framework and they didn't have validated tools to assess their programs, their learning programs. So my graduate students and I designed this framework with the idea that it would be a quality standard for e-learning. And it also, the components can be used with face-to-face learning. So the We Learn framework, if you get on the link, you can mouse over, and all the variables within the framework are defined. And they're also defined in the papers. But basically, the notion behind it is that if you follow this framework, and the bottom of it is on if you follow this framework, you'll have better outcomes in your learning. And in addition to designing the framework to guide the learning, we also evaluated a toolkit of evaluation tools in both French and English, qualitative and quantitative, and to evaluate programs and learners who are in programs that are using the We Learn framework to guide learning. And the 2 of these tools are now validated and they're published as well. So, and there's an article on how the tools were designed and with links to the articles. So I will provide all that for you. Let me go back to my... So, the We Learn framework very basically says that if you want to design an effective program, that you have to situate it in. First of all, we developed a partnership learning model, and that's also published. And when we used that in high-tech companies, this is back in the 90s, they said, we didn't have outcomes. And they said, you know what, we're spending billions of dollars on training. We need to know if we design the program that we're getting the outcomes. We can justify the money we're spending on training. So the partnership learning framework that was published in 1996 became the We Learn framework. Then we had the demand-driven learning framework with the idea that learning is pushed by the demands of the learner. Because what we found were learners were coming to university and they were complaining about their education. No one answered the phone. Registration was difficult. The courses weren't effective. The profs weren't effective. So this framework talks about you need the proper content, and define that means it has to be inclusive, authentic, evidence-based, etc. I'm not going to go too far into the framework, but you can read about these variables. Even if you mouse over them in the online version, the definitions of these variables will come up. Media is is the delivery mode, has to be usability, user-friendly, easy to navigate, etc. Service is things, and service is the word I came with by collaborating with high-tech industry, and we published that in the partnership learning model, and we never had seen the word service used with education in 1996. Now we see it quite often, but we think that we were the first person to publish service, and I got that by working with high-tech companies who talked about their clients and service and meeting the needs. So You have to attend the service, so it has to be organized, accessible, responsive to the learners. And High Tech told me that it has to be situated in structure. So you have to know what they need. So needs analysis in any education is a vital component, and we always do needs analysis before we design our online programs. If you do all these things and you embellish it in social constructive theories and ongoing evaluation, so it's an emerging design, you should get satisfied learners, Kirkpatrick's 4 levels of evaluation, and higher. So this is the basis behind it. The evaluation tools, I know you can't read this, but I'm just going to talk about them briefly. This one is a program evaluation for programs using the We Learn framework, and basically it talks about evaluating the content delivery service outcomes, the components of the program, and it's a Likert scale. And it took us about 2 years to design it using experts in the field. We would design it with my graduate students. We'd have people sit around a table over dinner, and they would scrutinize every question. We wanted it on one page. We wanted it quantitative because people like fast evaluation tools. So it's very user-friendly. It's been tested in 4 countries, New Zealand, Canada, United States, and is now validated, and there's an article published on this as well. And it's also evaluated or available in French. That's the French version, which are the 2 national languages of Canada. This is a second quantitative evaluation tool that we designed to go along with the We Learn framework, and it is to evaluate their learning, the learner's learning. And what we found with all our online programs, and we've been designing many for 15 years, is that we could show that the learners learnt the program, but we couldn't show changes, or we could show that they improved their learning by a pre-post test, but we couldn't show through our evaluation that they changed their behavior or attitudes. And we couldn't find any other program in the research or literature that showed significant differences either. So we thought, okay, we can't show this, and we need to show this for companies to justify the money they're spending on training and to also be accountable in our online programs at university. So we'll change the tool. So instead of a pre-post design, this, although you can't see it, the variables on the left, the idea is it's a post-post design. So rather than giving it to the learners before, we give it to them after. We say, how do you think you were before and how do you think you are now? And now we can show a significant difference in their pre and post through reflection. It's self-reported, guaranteed, but so was the pre-post before. The idea was, we think, because they were often volunteers, they were already self-motivated, similar to your program, or else they didn't know what they didn't know. So with a post-post design, we found are now able to evaluate our programs and show a difference, not only in learning, but in attitude and behavior. And this tool is also published in our toolkit paper, but also it's validated now and in several countries, and also an article published. It's also in English and French. This is our third tool in our toolkit of companion instruments for the We Learn framework, and it's a qualitative tool. And again, you can't see it, but in the first column are the core competencies that you will be evaluating. In the second one, they're personal objectives. So, for example, the first one says the competency is communication, and it says communicates and expresses ideas in an assertive and respectful manner. So that is what they are expected to learn. The next one, it says, is the learner saying, I want to, and we also have one for teamwork that says we want to, so there's 2 tools in this, and it's also in French and English. I want to listen to the ideas, concerns of my team members. So there's a list of competencies that the learner decides, or the team decides that they want to learn to meet the competencies on the left. The next one is strategies, so they come up with strategies. It's a learning plan, so if they're in a team, they would decide how they want to plan their learning to meet the objectives, to attain the competencies. And so it's a planning tool in that sense. But the last column is learning outcomes. So it's a reflective tool. When the learning's done, they would look at the competency, their objectives, and their planning, and then they would say, I now share my knowledge and expertise with, so it becomes an evaluation, a qualitative evaluation tool after the fact. And we also came up with an exemplar, and these are all available online, that give them a completed tool. The reason I did that was I found when we would get together, I usually work with healthcare people. We sit them around a table, doctors, nurses, pharmacists, and to do teamwork and interprofessional education. And they would think, why are we here? I don't know what you do. You don't know what I do. So by giving them an exemplar, I found they could read it and say, okay, here are the competencies. Here are some ideas. I would never do that. That one's stupid. I don't like that one. But here's one we could use. Or here's one we could adapt. So by giving them an exemplar, I found they understood better what they were supposed to do, and it sped up the learning. So there's also the qualitative tool. It's not validated, and it's not as popular, mainly because it takes so long. People want fast tools. But it is used in courses where people have an audience, where they have them for a whole term and can use it, like in nursing courses. It's quite well used. So that's our framework in a nutshell and our companion tools. This is one program we've used it in. It's a 6-year program, a CIHR grant, Canadian healthcare grant, 1.9 million over 6 years. And the purpose of the program was, the presentation, I'm going to just show you some of the findings that we found from this program. And this program was designed by 7 collaborating universities in Ontario, Quebec. In Ontario, a bunch of researchers in reproductive medicine got together and wrote the proposal, got the grant, and the whole idea was to take their master's, PhD, and postdoc students in reproductive medicine and train them to enhance their graduate program. So twice a year, I'm going to go through this quite quickly, twice a year semi-annual meetings are held where the students are brought together in one setting with the mentors. It's almost a one-on-one. There might be 20 mentors and 30 students. And they have presentations, workshops, and enhanced learning. Sometimes they go to the hospital and to labs of the professors. These people are the ones in the white coats that work with the sperms and eggs, and they help people get pregnant. They can't get pregnant. They work on cancer, uterus cancer, cancer of the uterus, ovarian cancer, prostate cancer. So this is the kind of research they do. They're always in white coats, and they're very insulated. And when I go, I'm the program evaluator for the 6 years, and a lot of the things they talk about I really don't understand, but I don't need to. We use the We Learn framework and the tools to assess it. So sometimes, for example, they'll go to the hospital and they'll see all the slides of pregnant women, so they can say, what's this slide? And they'll say, well, okay, that baby's going to be born with Down syndrome or spina bifida. And then this woman has to educate the mother to say, this is what's going to happen and what do you want to do, etc. Or then they'll go and they'll go to the lab and they talk about, what was interesting for me is the researcher in the white coat who never sees the patient, the doctor sees the patient, would talk about, inserting the egg with the sperm, and you have to pull it this way first or you'll break it, and when you harvest the eggs, you might get 32 eggs, and when you communicate that to the parents, they're very excited, but you know that you have to take all the big eggs and the little eggs, and that only 8 of the 32 are going to be alive the next day, and so there's a lot of ethics involved in how you communicate to the mother or the parents, and that it's very painful and it's very expensive, and then they can freeze them, but if you freeze them, you need to freeze all of them, and then when you thaw them, you have to thaw all of them, and so the thing is that it's the ethics, the care that these researchers had for the mother who they never see or the family they never see was really inspiring for me, because I have one sister that went through this, and I know the trauma and the stress and the emotional currency that they pay for this process. So then they might take a tour of the lab or the nursery where the babies are born, and they see these preemies. And what was interesting for me is when they see the preemies, they think it helps them see the connection between their research and the outcome. And it was like, man, are we doing the right thing? Those babies are very premature. They're always going to have complications. They're going to cost the medical situation millions and millions of dollars to keep them alive. So it was really interesting. But the education program that we get, what was interesting is that the first meeting we had, all the mentors who like each other and work together and sat together, and all the trainees sat together. And the evaluation that we did, we gave the survey after every workshop or every presentation, and at the end we interviewed them, the qualitative interview. And they would say, we want to spend time with the mentors. We want to know what they do. So when I would analyze the data and write the 65-page report and share it with everybody, the mentors would listen and make changes. So the next time they would deliberately sit next to a student, okay? Or they would deliberately, at the networking dinner at night, they would deliberately sit with the student. So they made changes according to the feedback and the evaluation. If they said they didn't like a workshop, the workshop wouldn't be offered again. If they said they wanted a workshop, they created a workshop. Sometimes they said they wanted the mentors to present, make presentations, so the mentors made presentations. They wanted to present the research, they did, but then they didn't get feedback. So we evaluated it on content, delivery, structure, outcomes, and got all the feedback and made big changes. It was a mixed method study with quantitative and qualitative. We answered the research questions. How did trainees react to the learning experience? Did they acquire new knowledge, and did they transfer it to the workplace? Many programs started from this. There were 2 interviews with mentors, 2 with trainees, so we got both sides. There were 15 PhD students, 9 postdoc fellows, and 5 master students from all these different universities in Ontario, Western, University of Montreal, University of Ottawa, Laval and McGill, and the mentors were from the same place. So they said it exposed them to information they wouldn't otherwise get. It gave them a leg up. It opened up job situations for them. Sometimes it helped them figure out who they wanted, if they were a master's student, who they wanted to do their PhD with. It helped with, some of them had gotten hired since then, and it opened up different jobs for them. I'm not going to have time to go through all of this, but when they didn't get feedback on their presentations, they asked for it, and because of the evaluation, the mentors provided feedback, and they found that very helpful. They also were doing poster presentations, and they found that they wanted to see their colleagues' posters, so they divided it in half and had one half one day and one half the other. So they could not only present and get the experience of presenting, but also see others. They wanted workshops on how to write an article. So one of the mentors was the main editor of the top journal in their field, and he presented what he looks for and with his colleagues, and they found that very helpful and an advantage. They also wanted ones on how to write proposals. So some of them, they had a mock interview, and they had a proposal that one of them had written, and the mentors broke it down for them. So basically, I'm going to take you now to show you some of the different other programs in my 2 minutes left that we have evaluated using this program, and a lot of them are ebooks. And so if you look at, if I can escape here. We are now using the framework to develop a lot of ebooks, so I'm in 2 minutes going to glance at 1 or 2. So in the Faculty of Medicine, they're going up for accreditation, and accreditation in medicine is demanding that the students are not only evaluated in the medical skills, but also in the non-medical skills. And those include being a health advocate, being a professional, being a scholar, being a communicator, a collaborator. So they are going up for accreditation, and when we did a needs analysis according to the We Learn framework, we found out that their mentors or their supervisors said, never mind evaluating them. A lot of our supervisors don't know what they are or how to teach them, let alone evaluate them. So we knew that we had to provide support and training to help trainees evaluate their learners at the point of care. So we decided to run workshops with companion ebooks. So these are the ebooks, and they're designed on what is it, how do I evaluate it, and how do I teach it. They have all kinds of links. They're free. There's links to many articles. There's questionnaires. There's lots of videos that we created with experts in the field. We have done research on video and online learning and found it has to be short, and especially with physicians, unless it's something, they rather read it unless it's something, a skill. So we have published papers on using video in online learning to enhance it. So we have a lot of these ebooks, so I'm going to stop now because I don't want to go over time, but I'm going to show you a slide with a lot of these links. A lot of these things are free, and if you want to take a picture of it, you can have links to some of these ebooks and frameworks. We've developed a lot of different frameworks to guide learning, and that might or might not be helpful for you. Here's the slide that might help. Okay.